Some of the ortho problems in pediatrics, and today let us discuss about the hip dislocation in children. Coming to the hip dislocation of the hip is a common injury to the children, and usually it is at the hip joint, and dislocation occurs when the ball shaped head of the femur comes out of the cup. You know that this hip means usually it is a ball and socket joint, and usually here the ball, when it comes out of this socket, that leads to the dislocation of the hip. This may happen to varying degree. A dislocated hip much more common in females than in males, and here it is more in females than males, and the condition can be either congenital or acquired. And usually, coming to the definition, it is an injury in which the bone is displaced from its proper position and femur bone separated from the acetabular cavity, and the causes are usually vehicle accident, congenital disease and heredity. These are the causes. It is performed by an examiner first flexing the hips and knees of the supine infant to 90 degrees, then the examiner index fingers placing anterior pressure on the external trochanter. That means usually when we examine the hip joint, what happens, we can see that there is a gap in between the ball and socket joint, and they are differ. The position usually seems to be differ from the exterior also. And coming to the Marlowe maneuver, it is nothing but it is another physical examination performed on infants, and here the adducting the hip and they place the patient in a supine position, grasp the inner aspect of thigh and apply outward and downward pressure to the thigh in this posture. Usually you can see the clunk sound means that is one oculanti. It means it indicates like an irregular sound, and it can be performed by the examiner first flexing the hips and knees of the supine position of the infant at 90 degrees, and usually in this a positive sign of the distensive clunk can be heard and felt as the femoral head. And usually the Marlowe maneuver is a physical examination performed on infants, and the place of the patient in supine position, grasp the inner aspect of thigh and apply outward. Coming to the posterior dislocation, usually the posterior dislocation, it is classified into several types, that is type 1, type 2, type 3 and 4, 5. Usually here the dislocations are pure dislocation and dislocation with large posterior wall fragment, and dislocation with comminuted posterior wall, and dislocation with acetabular floor fracture, and dislocation with femoral head fracture. Usually the signs and symptoms, you see the patient is unable to walk or adduct, and here there is a nerve injury, and pain in hip and buttock can be seen, and loss of sensation can be seen, and sometimes local hematoma also we can see. This can be diagnosed by means of X-ray, CT scan and MRI. Usually the complications here are sciatic nerve injury and pain in the distribution of the sciatic nerve. Coming to the management here, the popular management methods are closed reduction of the hip, that is Bigelow maneuver and Alice maneuver and Stimson gravity technique. These are the management techniques used here. Coming to the next classification of the anterior hip, the dislocation is according to the types. Superior dislocation including the pubic and subspinous, that is there are sometimes there will be not associated with the fractures, and sometimes associated with the fractures of the acetabulum and femoral head. And inferior dislocations include several fractures and perineal fractures also sometimes. The signs and symptoms, coming to the signs and symptoms, usually pain in the hip area and inability to walk, and adduct in the leg. Usually there is dull aching pain and pallor, paresthesis and coldness we can see. Coming to the management, here also the management is same as reduction management. The complications are usually necrosis and femoral nerve injury and femoral artery injury. Okay, ma, sorry for the disturbance. Coming to the management, usually here the management is by giving the analgesia, general anesthesia may be given to replace the femoral head, and jumbo processes can be done, and long-term management includes physiotherapy to strengthen and stretch the surrounding muscle. The complications are osteonecrosis and post-traumatic osteoarthritis, femoral head fractures and thromboembolism. Coming to the next complications are secondary acute pain and related to the biological and psychological, physiological stress. Coming to the interventions, usually the intervention is based according to the needs of the patient, like pain intensity and duration, location, and comfort measures and diversional activities, stress management, and therapeutic touch. And about 15% of all injuries in children are fracture injuries, and bone fractures in children are different from adult bone fractures because of child's bones are still growing, and for example the original shape adolescent lands and force are too weak. The bones of the child are more likely to bend than to break completely because they are softer and the periosteum is stronger and thicker. The fracture involves bend on one side of the bone and the partial fracture on the other side. The name is by analogy with green wood. And here usually the fracture may be tarsus and buccal fracture, and it is metaphysical location and resemble as the tarsus and base of the pillar, and it usually results by the force acting on the longitudinal axis of the bone. Here the bow fracture also may be seen. In bow fracture, usually the bone becomes curved along with its longitudinal axis, and hairline fracture, that is an incomplete fracture, can be seen. The bone is fractured only in one place, that is fracture in two or more places in the same bone may be seen sometimes. And the term bucket handle fracture is used when where the loose bone is rather wide at the distal end. The fracture resulting in the ends of the bone penetrating the skin, and a fracture where the bone cracks completely and the pieces line up. And usually the symptoms are widely experiencing a bone fracture, pain in fractured area and swelling, and obviously deformity can be seen, and sometimes normal manner also can be seen after fractures also. And there may be bruising, warmth or redness in the fractured area. And children who are at high risk of the fracture of low bone mineral content, and children with generalized disorders, neuromuscular disorders, and fracture personality. Children in general area at greater risk because of high activity levels. Difference between child and adult bones. There are various differences because they are very delicate in children. And the general treatments for common fractures are cast immobilization and functional cast or brace and traction. Thank you, ma. Hope you understood the topic. We'll continue.